Dr. Jason Fleischer with Inner Eye Chiropractic. I'm just going to give you a quick anatomy lesson. So when we look at the spine from the side, we notice this is the head, which is beautifully drawn, by the way. And then you have a set of vertebrae. So getting into the naming so you know where everything is, the cervical, there's 7 of them in the neck. Thoracic, there's 12. And then your lumbar, there's 5 lumbars. And, debatably, but basically one big bone is your sacrum. So these curves right here are super important. There's discs in between each one, which makes up about a quarter of your spine, actually. So when they dry up, you can lose some height. But the curves right here are very important because they're actually your shock absorbers. You think it's your disc, but it's not really. So what happens a lot of time, we talk about forward head, posture and stuff like that. We have poor posture where we're kind of like this, hunched forward. Well, could you imagine holding a bowling ball out here, which is basically like your head? You're holding it out here. How long before you get sore and tired? Not long at all. But if you can bring it in here, which represents good posture, it's a lot less stress on these muscles. So that's why it's so important, postural. But as your posture changes and you come out like this, you start losing these curves. They straighten out. You hear of military neck or straight neck. That's when this actually comes forward and straightens out. So what happens, what happens when you take that shock absorber? So this is like your neck, your head's on there and it's shock absorbing. If it gets straight, boom, it's pounding. And that's when those discs start getting really damaged. So it's important to, keep this stuff moving. But other than that, when you start having degeneration down in here, what happens is there's nerves that exit the spine and come through little holes in the side. And as that compresses down, that can put pressure on the nerves going in wherever they go. If it's in the cervical, a lot of times that can cause headaches, TMJ type stuff, different things like that. And you can imagine coming down through here, you can have problems with your heart, your blood pressure, gastric reflux, a lot of stuff like that. Lumbar, of course, you see a lot of sciatica and stuff. So it's really important to get yourself straight and then maintain that posture. And we'll do a segment on the proper exercises for that. But I just wanted to give you a little anatomy lesson. Again, this is Dr. Jason Fleischer from Inner Eye Chiropractic. Keep your inner eye wide open.